Hello everyone, my name is Jan Weichert. I'm head of the prenatal division at the University Hospital of Schleswig-Holstein here in Lübeck, and a warm welcome to you. What we gonna talk today is about the biometric assistance and automatic assessment of biometric parameters, and we further focus on the assessment of cardiac structures either in B-mode ultrasound and in color Doppler ultrasound, and finally we will apply a semi-automatic technique, the 5T heart technique, to automatically reconstruct cardiac structures, and this is what we're going to do today. I would like to show you the performance of the V8 machine in assessing the fetal cardiac structures. And I will start here by enlarging the frame, enlarge the scan area a little bit increase the gain and enlarge the whole image here. And this is the starting plane for all echocardiography done prenatally, and you see here the starting plane is the same plane which we need for the assessment of the abdominal circumference. You see all the structures are corresponding to a normal anatomy. This means the baby's head is pointing downwards. It's a cephalic presentation, so the fetal back is on the right side and the fetal stomach, the fetal belly button, will be on the left side. So the upper part is therefore the right side and the lower part here of the image is the left side. So I then go slightly upwards, slightly cranially to see the fetal thorax and the fetal cardiac structures here. And this is a nice view of a lateral four chamber view. And the four chamber view is one of the most important planes when assessing the fetal heart. And you see the baby's moving a little bit, but I will just go back and you see here the perpendicular view of the fetal septum, the interventricular septum. See the both valves here, and I just let the image run again, and this lateral view shows you the integrity of all cardiac structures which can be assessed in this view, which means this is the right side of the heart, this is the left side of the heart. You see the foramen ovale, the flap of the foramen ovale, and when we run the image again, see how the flap moves and the atrioventricular valves are arranged. You see the smooth appearance of the leaflets of the valves. You see that the valves are open here and closing here, and when I move a little bit more towards the fetal head, you see that the outflow tracts can nicely be displayed starting with the left ventricular outflow tract, which means the ascending aorta, and you can follow the aorta all the way upwards as they goes into the transverse part of the aorta, and which communicates with the right ventricular outflow tract and the arterial duct to form the three-vessel trachea view. And this is the three-vessel trachea view. Three vessels because of the main pulmonary artery, the transverse aortic arch, and the superior vena cava, and this is the trachea. So when we go just a little bit backwards to the lateral four-chamber view, you see here the inflow of at least one pulmonary artery going to the left atrium and pushing a little bit more cranially. You see the incoming of the left pulmonary vein into the left atrium. So just again, this is the left ventricular outflow tract, and a few degrees tilted and moved upwards, you see the right ventricular outflow tract. You see the branching of the right pulmonary artery, and on this side, and the arterial duct going to join the transverse aortic arch. So, and this is what you need to judge the cardiac integrity seen in the normal B mode. And when we just want to confirm that there's no abnormal flow in the cardiac structures, you can simply do this by adding the color, and this is what the machine does very well. You see here a nice and very sharp inflow of the blood into both chambers. You see that there's a clear separated inflow, and just crossing of the midline structures across the foramen ovale, and this is what you need to judge the normal anatomy. And this is a nice view as well. You see here the bifurcation of the both pulmonary arteries and the three-vessel trachea view in color. I just reduce a little bit the gain to see the V-shaped appearance of this three-vessel trachea view. Okay. Just again, see the crossing of both outflow tracts here, the aorta. You can nicely, very clear and very smooth and sharp display of the color and the flow from the ascending aorta to the transverse aortic arch and the joining of the arterial duct. Okay. I can just move the transducer a little bit to see the apical four-chamber view, and you can, when you reduce a little bit more the color gain, you can get an impression if there's any reverse flow, any insufficiency of the AV valves, and you see there's no insufficiency of both valves. And just switch off the color to show you how the offset of both AV valves looks like, and one can see that the offset of both valves is a little bit different, means that the tricuspid valve inserts a little bit more towards the apex, and the mitral valve inserts a little bit towards the basis of the fetal heart. And this is what you have to be sure on every occasion, on any occasion when you do the cardiac scan here, and just to make sure that both AV valves are not in the same level, and this is very important to know. Going back to the lateral 4-chamber view, you see again the integrity, and you can see how the AV valves and the papillary muscles insert, and this is very, very important, and this determines the left and the right ventricular origin. You see that the muscles, papillary muscles, which are connected to the tricuspid valve, insert at the moderator band, and on the right side, and on the left side the muscles insert or have their origin on the left ventricular wall, which is a direct hint to see what the origin and the nature of both main chambers looks like, and this is very important to know when you're facing any abnormal anatomy in the fetus. So again, pushing on the color, see the nice picture here, and the nice separated in sharp and crisp color flow here. So we stop here, and I would like to show you another feature of the V8 ultrasound machine, and choose the volume probe and switch on the fetal heart preset, and see what you get. Nearly the same impression of a very clear and superb image quality, even with a volume probe. I just increased the gain, increased the image here, just to make sure that most of the image, most of the frame is filled by the target structure here, the fetal thorax and the fetal heart. So I would just put on the region of interest, which covers the complete thorax, and I will do a 3D scan of the fetal heart, and I have to increase the angle of acquisition to 35 degrees. The time of image acquisition is put on 12 seconds, and then I start the acquisition, and I recommend the mother just to breathe slowly, and then I run the volume. The baby is a little bit moving. I save the volume, and I take another sample. And cancel because of the movement of the baby. Again, baby, be quiet. Excellent. So I save this volume again, and I'll show you the result immediately, but I will do another static volume, and I show you what it means. So again 35 degrees, and I will acquire the volume within 1 second, and it's the so-called static 5D heart, and this means I acquired the volume in a very, very rapid duration of the scan, 1 second, and I have the entire anatomic structures within this volume, and I can apply the 5D heart tool to assess the anatomic structures here, and I prefer to do this in sepia color. And you see here on the right, I have to mark 7 anatomic structures, and prior to this I can assess the image quality in this 3D scene, and I see here that all the anatomic structures are captured within the volume. And I start with the aorta at the stomach. You see on the right side, upper right side, there's a template how to mark the landmarks here, and I will mark the aorta at the stomach, and I will be asked to do the same at the level of the 4-chamber view, and I mark the crux, and I press here no, and then I mark the septum and draw a line from the atrial wall towards the crux and the entire septum. Press yes, and then I mark the pulmonary artery. You see the program gives you the most likely position of the next structure, and I just have to confirm that this is the structure I will have to mark, and I would like to mark, and this is the superior vena cava, and the last one, this is the transverse aortic arch, and this is the result. You see here that this static volume has resliced the volume into 9 different views, into 9 different volumes, and I can label all the structures here, and you see that 3-vessel trachea view can be a little bit be more pronounced here. So I shift the reference plane a little bit down or upwards, and I do the same for the 5-chamber view, and the left ventricular outflow tract, the right ventricular outflow tract is displayed nicely. See here the bifurcation, and you see the ductal arch and the aortic arch pretty well, and both vena cava here. And this is an entire echocardiogram recorded and acquired within 1 second, and automatically aligned and resliced into 9 different views as you need for assessment of a complete fetal heart. So I stored this on the machine, and I just released the image, and I can do the same when I reload the first volume. And what is here different to the last volume? You see the 3D scene shows a pumping heart. So this is not a static. This is a regular 5D heart volume and displayed in the 3D scene. And I just quickly run the volume here and apply the program. Against aorta at the level of the stomach, aorta at the level of the 4-chamber view, mark the crux. And I skip the residual points to mark, and this is done automatically by the program. and you see the pumping heart and the structures very well, and you can judge all the single frames, the single templates here from the 3-vessel trachea view, 4-chamber, 5-chamber, left, right ventricular outflow tract. You can slightly adjust the plane here again. The aortic arch, and this is what you need to judge the anatomic integrity, and this is very rapidly and quickly done either in a static acquisition mode or with a 5D Hort technique. I've now tested Samsung's new ultrasound machine V8 for several months, and I have to conclude that this system has a brilliant performance with brilliant and super B-mode images, very crisp and clear Doppler interrogation, and in 3D ultrasound the machine has several features for any purposes, and I clearly recommend the use of this ultrasound machine. And the discussion is now open. I thank you for your questions.